Students, we are going to discuss inspection and palpation of cardiovascular system. But before going to start with inspection and palpation, you should know the symptoms which are corresponding to CVS. So symptoms such as dyspnea on exertion, just now we have discussed, right? Dyspnea on exertion, chest pain. Typically, chest pain is at sternal region. That is a symptom which is related with cardiovascular system. After that, edema, special edema, wetting type of edema on lower limb, bluish discoloration of skin, that is called as cyanosis. And one more symptoms which is belong to cardiovascular system is breathlessness. So these are few symptoms which belong to cardiovascular system. With this, we start with the inspection of cardiovascular system. What is inspection? Inspection is just to inspect patient or subject without touching him. So we have to inspect this cardiovascular system, we have to inspect heart, and what findings we are getting, that we have to interpret. That is nothing but inspection. So we are going to inspect first the region of the heart of this particular subject. So the region of the heart is called as precordial region. Precordial region is a region where heart is present. So all of you know it present just behind sternum and little bit left part of the chest. So this precordial region is this one behind sternum and the left part of the chest. That region is called as precordial region. The heart is present behind this region. Have you noted it? Precordial region. So first point is inspection of precordial region. Just now I told you inspection is just observation of the system. So I am going to inspect this particular region. I will concentrate, I will focus totally on this particular part, precordial region. I will try to see any bulging or any projection is visible or not. I will try to see apex beat in inspection. Okay, apex beat I will try to find out, but apex beat is visible in thin subjects, and this particular subject is not a thin, right? This patient is not a thin, he is a little bit fatty person. That's why apex beat is not visible in this case, in this patient, right? But if it is visible, you should note this point. If the apex beat is visible, it is present at left fifth intercostal space, 1.2 centimeter inside mid clavicular. I will repeat, apex beat is present at left fifth intercostal space, 1.2 centimeter inside mid clavicular line. This is a area of apex beat. Normally apex beat is present in this area. So what is interpretation? How to find out this area? So approximately you concentrate here, try to look at left fifth intercostal space, 1.2 centimeter inside mid clavicular line. Mid clavicular line is approximate line, okay, which is drawn from the middle point of clavicle and which runs down and joined to the mid point of inguinal ligament. This is the mid clavicular line, it is imaginary line. So approximately this line runs here, from like this here, and the apex beat present 1.2 centimeter inside mid clavicular line somewhere here. But in this subject it is not visible, being a fatty person, isn't it or not? In females also it is not visible because of presence of breast. So this is the just inspection of apex beat. Then the second point is inspection outside precordial region. So just now we have seen the points of inspection in precordial region, any bulging is seen or not, and apex beat. This comes under inspection of precordial region. Now second point is inspection outside precordial region. So in that we should not miss two areas. The area of neck, here you have to observe any swelling is there or not. So usually there are two veins are present in the area of neck, that is jugular veins and carotid
artery.
So we have to observe any swelling or any bulging is present at jugular vein or carotid artery. We have to observe from right side
to left
as well
side.
as we have to observe from
Left side.
also regarding any bulging or swelling in the region of the neck. One more is seen, that is in the epigastric region. This region we have to observe in thin persons. Again, aortic pulsations are seen, but you have to also observe aneurysm, aortic aneurysm. The bulging is seen in case of aortic aneurysm in the region of epigastric region. In the same way, the swelling in the neck region is of carotid artery aneurysm. That point you should not miss during examination outside precordial region. So this much are important point you have to observe in inspection. Now the second point will be you have to do today, that is of palpation of cardiovascular system. So under palpation, again whatever we have done finding in inspection, that you have to confirm. All inspection finding we have to confirm in palpation. But here we have to touch the patient. Unless and until you are not touching, how palpation can be performed? So in that the first is palpation of apex bit. Now I am going to demonstrate you how to palpate apex bit. For that you have to use your whole hand. So place your hand at the region of precordial region.
Precordial.
I have placed my hand on precordial region, and slowly with the help of your two fingers try to locate apex bit like this. Okay, I am using my two finger or even one finger, and I am trying to locate apex bit. I am trying to palpate apex bit. I will again repeat. Place your hand on precordial region with the help of two fingers. Try to palpate apex bit slowly at one region. You will be able to find apex bit. Yes, I am able to feel apex bit. Now what findings to be done? The first finding is position of apex bit. First, I am going to see position of apex bit. Again, all of you know, just know the point. I will repeat the position of apex bit. It is present at 1.2 centimeter inside mid-clavicular line in fifth intercostal space. You have to confirm whether really it is located at the same region or not. Okay? If there is enlargement of heart, say hypertrophy, the location will be not in the fifth intercostal space, it will be in the sixth, and it will be not 1.2 centimeter inside mid-clavicular line, it will be outside mid-clavicular line in case of enlargement of heart. Are you getting it or not? Simple. You have to confirm whether it is at normal position or not. So, palpation of apex bit like this. After this, we have seen position of apex bit. Normal subject will be given to you. So, normally position is at 1.2 centimeter inside mid-clavicular line. Second point that we have to palpate, that is character of apex bit. After position, we are going to see character of apex bit. So you have to feel. So you are after palpating this apex bit, you are going to get thrust. Normal thrust, uplifting of fingers or normal thrust you are going to get. It should be normal. It should not be a forceful thrust. If you are going to get forceful thrust to your fingers, forceful uplift, to your fingers, definitely it indicates hypertrophy or enlargement of heart. Usually it is seen in hypertension. In hypertension, patients, you are going to get forceful thrust, forceful oblique to your fingers. Are you getting it or not?
Yes, sir.
In the same way, in case of nervous patients, you can get forceful thrust. Okay? In case of hyperthyroidism, you can get forceful thrust. In case of even normally after exercise, after running, after jogging, after exercise, you can get normal thrust, forceful thrust. Isn't it or not? That you have to feel. And the reverse of it is nothing but feeble impulse. Okay? Even after palpating, trying to palpate, you are not getting proper thrust, normal thrust. It is called as feeble type of impulse that you can get in cardiac dilatation. So cardiac dilatation and cardiac hypertrophy are opposite thing. In hypertrophy, you are going to get forceful thrust, and in case of cardiac dilatation, you are going to get feeble impulse of heart.